Have you ever wondered how a disease that typically affects birds can impact human health? Today we delve into the recent bird flu case detected in India. The World Health Organization confirmed a human case of bird flu in the country, making headlines across the globe. The infection caused by the H9N2 virus was discovered in a 4-year-old child in West Bengal. The child had been struggling with persistent severe respiratory issues and was admitted to the pediatric intensive care unit of a local hospital. This isn't the first time the H9N2 bird flu has made its presence known in India. The first case was reported back in the year 2019. Such instances serve as a stark reminder of the invisible threats that can cross the species barrier. But who does this disease affect, and how does it spread to humans? Bird flu, or avian influenza, is an infection caused by avian influenza type A viruses. While primarily a disease among birds, this virus has the unsettling ability to jump species and infect humans. The mechanism? Quite straightforward yet alarming. Humans can contract the virus through direct contact with infected animals, particularly birds, or by touching surfaces contaminated with the virus. Imagine a scenario where a person handles a bird with the virus or comes into contact with its droppings. The virus can enter the human system, leading to infection. The environment plays a crucial role too. Areas heavily populated with birds like poultry farms or markets selling live birds are hotspots for the transmission of the virus. Here, the virus thrives and spreads, not just among birds, but potentially to humans interacting within these environments. Diagnosing avian influenza in humans isn't guesswork, but requires precise laboratory testing. According to the World Health Organization, specialized tests that detect the virus's genetic material are necessary to confirm infection. This is crucial for timely and effective treatment. Now that we know how the disease spreads and is diagnosed, how can we avoid contracting the infection? Prevention is always better than cure, especially when it comes to infectious diseases like bird flu. The World Health Organization, a trusted authority in global health matters, provides some key suggestions to help us steer clear of this virus. First, it's crucial to minimize contact with animals, particularly in areas known to be affected by animal influenza viruses. This includes farms, markets, or any setting where live animals may be sold or slaughtered. But what if you can't avoid these areas completely? That's where personal and hand hygiene come into play. Washing your hands thoroughly with soap both before and after contact with animals is an effective way to reduce the risk of infection. It's such a simple act, yet it can make a significant difference in our health and safety. Remember, staying informed and taking the right precautions is the best way to keep ourselves and our communities safe.